This is the glenohumeral joint, the joint between the humerus and the glenoid fossa. It looks complicated. It's not. I guess it would be if you had to do surgery on it. But as far as naming it, once you're comfortable with the names of the bones and processes, that's what we name it for. So here's the model. All right, this would be an anterior view because here's the clavicle articulating with the acromion. This would be a right. And so if we look at this diagram up here, just to get you oriented, here's the head of the humerus. Here would be the scapula. This is an anterior view, so you're looking at the coracoid process here. Clavicle articulating with the acromion. Right? So let me diagram that on the board. So the head and the glenoid fossa. That's our actual joint. And then we have the scapula's coracoid process, the acromion, and then the clavicle. So the ligaments are identified for the bones or processes that they join together. Coracoid process to clavicle. All right? Here's the coracoid process. So dense, regular connective tissue, collagen fibers, connecting the coracoid process to the clavicle, form the coracoclavicular, and again, I don't care if you say clavicular or coracoid, coracoclavicular ligament. Okay. Then we have fibers joining. This is really weird because it's the same bone being joined by fibers. Coracoid process to acromion process. So that's going to be the coracoacromial or acromial coracoid. Again, I don't care what order. Between a coracoid process and the acromion. And then between the clavicle and the acromion, we have the acromioclavicular ligament. So again, on the model, coracoid process to clavicle, coracoclavicular ligaments. Coracoid process to acromion, coracoacromial or acromial coracoid ligament. Clavicle to acromion, acromial clavicular ligament. So if you're going to identify the processes or the bone, that's what the ligament is called, between the two that are attached to each other. All right, and then finally, from the glenoid process around the head, completely covering that around, we have the glenohumeral ligament. So here, you're not seeing it because it's cut, but on this model you can see part of it here, okay, and here, kind of wrapped around. The inferior aspect of these joints are the weakest. We look inside, here's the glenoid fossa right here. There's a piece of fibrocartilage, just like we have in the knee. There's a piece of fibrocartilage in here. That doesn't make it a cartilaginous joint. This is another synovial joint. All right? There's a gap between it. So this is a synovial joint, which makes what type of movement available? Diarthrotic. Okay. It's the weakest inferiorly because we don't have few tendons and none of our ligaments, so it's most likely to be dislocated. The shoulder pops, the humerus pops out with a downward force. All right, let's stop there and take a break for lab.